Oh, hey YouTube. So, I wanted to make this video for a while now, and the reason for that is threefold. One, I deal with anticoagulants every single day in the hospital, be it IV heparin for like a DVT, deep vein thrombosis, or a pulmonary embolism because you can't fucking breathe, or, we're giving you subcutaneous enoxaparin or whatever, or dalteparin, or if you're on orals like dabigatran, rivaroxaban, or Pradax is the other name for dabigatran, or warfarin, which a lot of people, it's a dirty drug, but it works. But that's a story for another time. So I deal with that shit all the time. The second is I pretend to know a little bit about fitness, and it's all pretend. Don't ever believe anything that I say. It's all lies. 100% lies. And the third is I can now speak to this topic from experience. And the reason I'm bringing this up is I'm very open on my channel about a lot of things. I've talked about my depression and stuff in the past, etc., etc. And until a week ago, I was on a 3-month stint of Pradaxa or dabigatran, which is a new age anticoagulant for a medical condition that may or may not have been diagnosed appropriately in a foreign country. Came back, was followed by a couple doctors, internal medicine, etc., etc. They don't think it was an actual thing, but for safety's sake, I was on an anticoagulant for 3 months. Which means I had the chance that I could bleed like a motherfucker. Sorry if you're not used to my channel, I kind of swear and I'm tired right now, so I only slept for 4 hours because I came off a night and then had to turn my clock around to days. So, I'll do my best to mitigate the swearing. So yeah, I have been on an anticoagulant and didn't miss a day at the gym or my diet or anything. Now, if you're already here, you know what an anticoagulant is, but I'm going to preface this video by simply saying if you don't need to take an anticoagulant, there is no benefit for fitness-wise. Do not do it. I read online when I first got diagnosed. I was trying to find as much information as I can, and there's just not enough goddamn information out there from fit people. A lot of the information that you find, can I continue my physical fitness level? Like, do I need to change my activity? And it's all from geriatrics or people in their 50s that don't, you look at their avatar and you're like, well, I'm really sorry, but I have trouble believing that you're a very fit, active person, right? And it was difficult for me to find any information online from somebody who is even a modicum of fit. And even when I talked to my internal medicine doctor, I said, okay, so, I do powerlifting and I like lifting heavy weights, can I keep doing that? And he was like, well, we tell people to continue their physical activity levels and adjust accordingly. So, I don't see why not. But in all earnest, I never had somebody in your physical fitness level on this drug, so I can't really speak from experience. And I was like, oh, okay, well, I guess I'll research what I can. And I found jack shit online. I found a couple of good ones from runners that had been diagnosed with something requiring an anticoagulant. And I found some athletes that had posted some information online that had also been on anticoagulants, but they weren't powerlifters, bodybuilders, or anything like that. They were long distance runners, or they were like basketball players. So I was like, okay, but you know what? There's crossing over. Like, I can use that. So let's get to what it's like to work out on an anticoagulant. And the first thing I'm going to address is the pump. Now, I happen to have a patient way back when, no names, but he was also an anticoagulant, and he was built like a tank. And when I stood beside him, I kind of laughed because I'm like, your arms are the size of my quads, holy shit. So we had a long discussion about anticoagulants and how it had affected our workouts. And one of the things that we both came to the same conclusion of was that you get a pump super quick, to the point where it feels like your muscles are going to explode. Now, I found this, and he found this. Now, I'm not saying it's going to be for everybody, but I would be in the middle of a set, and I'd be halfway through, and I would feel like my arm was just like, oh my fucking God, this hurts. And I would just keep going. You had to just fight through the pain. And I don't know what reason for that is. I don't know why it was. An anticoagulant or blood thinner doesn't actually thin your fucking blood. It just interferes with the clotting cascade in your blood. So I don't know why I would get pumps the way I got pumps. Now, we were on 2 completely separate anticoagulants, different families, so it was really interesting to me that we both had the same experience. Now, I had to change my workouts drastically over the last 3 months because, honestly, fear. I would get nosebleeds sometimes when I did deadlifts, back squats, even heavy bench sometimes. And normally a nosebleed would mean, oh, just put a cotton ball up my nose, because I have them in my gym bag for that very thing. and just carry on lifting. I already got a nosebleed. It's not going to not nosebleed anymore. But now, when I was on an anticoagulant, a nosebleed could mean a trip to the ER. Because the one that I was on, I'm just going to fucking bleed and bleed and bleed and bleed. I had one nosebleed while I was on Pradaxa, and it lasted for fucking 15 minutes. It was brutal. And like, I would be like 5 minutes in, and I'd let go, and it would just gush, and I'm like, awesome! And I waited for 15 minutes for it to clot. And it got to the point where I was like, okay, if this doesn't clot, I have to go to the goddamn emergency room. And who knows what they're going to do. And I have had patients in the past on anticoagulants that have come in with a nosebleed where we've had to give them a blood transfusion. They've lost so much blood. I'm not fucking kidding you. That is ridiculous. Anyways, so I had to change my workouts. I wasn't able to pull super heavy because I was afraid of getting nosebleeds, and it was totally fear because I didn't want to fucking pull a single and then have to go to the goddamn emergency room for 6 hours. So I ended up changing my workouts to heavy triples and then bodybuilding stuff. A lot of German volume training actually is what I'm doing now because I kind of sort of liked it over the last 3 months. But you get a pump fast. You'll find you get a pump to the point where, like I said, you're, oh my god, am I talking? I've been talking for 6 minutes. I'm sorry, guys. You get a pump really, really quick, and I don't know why, but it's like earth-shattering. Now you might be like, ooh, that's good for fitness, and yes, the pump is important, but there's a lot of reasons not to be on an anticoagulant if you don't fucking need to be. So you get a pump quick. The next question that I had was, how is that going to affect my joints? And, you know, I asked that to my internal medicine doc, and he was like, well, why would it affect your joints? He's like, what part of an anticoagulant affects your joints? And I was like, oh, well, shit, you have a point, all right? That was a stupid question. I'm a nurse. I should know better. And he's like, oh, well, you know, like, it's a valid question, I guess, but it shouldn't affect your joints. I did a lot of HIIT training. I did a lot of running. I continued to squat and deadlift, bench and whatnot, and I didn't have any joint problems. And I still don't have joint problems after 3 months of being on the drug. The runners that I've talked that I talked to online said it hadn't affected their running at all. They got pumps faster, go figure, but it didn't adversely affect their joints. So if you are getting joint pain while on an anticoagulant, it's probably not the anticoagulant. You might want to check out what's going on, because the anticoagulant's not going to affect your joints, which is good. So your joint health will remain the same. I wanted to know a little bit about how it was going to affect my healing process. Like, okay, so am I going to heal normally, like with the coagulopathy interfered with, and not coagulopathy, sorry, with the coagulation cascade being interfered with? Like, am I going to recover as fast? How's that going to work? And I got to be honest with you, personal experience, because, or maybe it was just me being a little bitch, but I don't feel like I recovered as quick, which is fine, right? You just have to alter. You have to roll with the punches, and I changed things accordingly. I felt like I didn't recover as fast from workouts than I did before I was on anticoagulants. And now that I'm a week off of them, I feel like I'm already recovering quicker. I don't know what part of the drug does that. I'm sorry. That is way beyond my pay grade. But I can tell you that I feel like I didn't recover as quick. Maybe it's because I was fatiguing too fast with like the pumps, or maybe I wasn't. I don't goddamn know, guys. But personal experience, I found that I didn't recover as quick. And you just adapt and overcome, right? I mean, that's the name of the game. So what did we cover? We covered pumps, crazy pumps. It's not really going to adversely affect your joint health. You might want to look into why your joints might be hurting if you get joint pain. Yeah, recovery was a little bit lower for me, but that's okay. I still was able to make quite a bit of progress. And one thing that I found was, you know, when I was taking them, I was doing a lot of different stuff that I wouldn't normally do, simply because I was like, all right, well, I don't want to accidentally bump myself, or I don't want to do this, or I don't want to do that. And while I did change my workouts, I was still able to do everything I used to do. And just like my doc said, you know, we tell people to carry on with their physical fitness level and adjust accordingly. Well, I carried on with my physical fitness level with the exception of the heavy singles. I did like heavy triples, so instead of pulling like 585, maybe I only pulled 535 for triples instead, right? Still decent weight-ish, but I don't have to worry about like gushing and hemorrhaging blood everywhere, at which point I'm sure I don't want it to look like a horror show just because I did a goddamn heavy single. So I don't know what else to talk about. I mean, being an anticoagulant with regards to fitness and diet, if you're on warfarin, I'm really sorry, you got to stay away from vitamin K, but you know that already because the doctors told you, which if you're really into fitness means like kale's right out the fucking door. I love kale, so that sucks. spinach right out the door because that's going to interfere. But if you're on a new age, like maybe taking dulciparin injections, enoxaparin injections, you're on rivaroxaban or Pradaxa or dabigatran, which is the other name for Pradaxa, you can get away with not having to worry about vitamin K. So an anticoagulant shouldn't really adversely affect your diet. You can just keep eating whatever the fuck you want unless you're on warfarin, which is vitamin K dependent, and vitamin K will interfere with the blood thinning effect and anticoagulation of warfarin. But hopefully your doctor already told you that. They should have. That's one of the biggest things we tell people when we put them on warfarin is like, you got to stay away from vitamin K. Figure out what's got vitamin K in it and don't eat it. Which this gentleman I was speaking with was like, that's one of the biggest fucking problems for me is I can't eat all the foods that I wanted to eat because I'm a bodybuilder and now I can't eat vitamin K. So I've had to adversely change his diet. But he found workarounds. He was able to do it, which was really awesome. And I got to hear his perspective on how he's changed his diet to continue making progress without really suffering as much. So it won't affect your diet. You can just keep eating. Now, if you find yourself getting heartburn when you're taking an anticoagulant, like an oral anticoagulant, I talked to the docs as well on that because I got wicked heartburn with Pradaxa, or dabigatran, which apparently is really common. And I just took a Zantac, which was the recommendation. Take like 75 or 150 milligrams of Zantac at the same time as your drug. Talk to your doctor first before following that piece of advice. I talked to my docs. They said, okay, but talk to your doctor first. But I would just take Zantac at the same time as I took the Pradaxa. No heartburn. It was awesome. What else? What else can I talk about, guys? I'm trying to cover as much as I wanted to know when I first started out. You don't have to change your workouts that much. If you're worried about getting nosebleeds like I did, then yeah, stay the fuck away from something that's going to give you a nosebleed. But realistically, unless you're going full tilt retard like I do, and you give yourself you make a problem for yourself, you shouldn't have to change anything, guys. You might have to alter, you might have to lower the sets, you might have to lower the weight, you might have to do something, whether that because you're not recovering as quick or you're not making as much progress. But I was still able to diet. I'm still dieting down. I'm still trying to adjust. My body's all fucked up because I'm like dieting down but trying to put on size at the same time. When I started moving away from like just strict powerlifting to doing bodybuilding, my body started to change. And I'm kind of like eating at maintenance, but like my body's changing so much because I'm not used to bodybuilding. It's really fucking weird. Like my body's doing crazy things with my weight and my size. I like it, but at the same time, anyways, I digress. You don't need to give a shit about that. That's not what you came here for. If you have any further questions, please post them down below. I'll do my very best to answer. I hope that answered the basics of it. Keep your exercise the same way it is and adjust accordingly, but you can keep doing the things you want to do. All right? Shouldn't affect your joints, shouldn't affect your diet, except if you're on warfarin, and then we talked about vitamin K already. Pumps are going to be fucking insane. You might not recover as quick. I didn't, but that also might be because I'm a little bitch. So take that into account as well. Yeah, that's about it. I'm really happy to be off the goddamn drug. Like I said, if you don't need to be taking this stuff, don't take it. The risk of bumping your head and bleeding internally and dying, or something happening that you don't realize has happened, like you tear your bicep, and normally your body would be totally okay, but instead you bleed for fucking 45 minutes into your bicep and it's this big now. Not worth it. 100% not worth it. So if you don't need to be on an anticoagulant, don't goddamn take it. But you're all smart people if you came here, so you know that already. Questions and comments down below, guys. Let me know if there's anything that I missed. I would be happy to answer from personal experience, both as a nurse who utilizes these drugs every single day, somebody who pretends to be fit, and somebody who was just recently on this medication for 3 months and had to completely adapt his lifestyle to accommodate. Now that I'm off the drug, you better goddamn believe I'm going back to heavy singles and I'm going to drive myself into the ground because that's what gives me joy in life. Isn't that just sad, pathetic, and petty? Anyways, guys, as always, remember, eat like a bodybuilder and train like a powerlifter.